Hi, everyone. Thank you for joining us today for another STEM Girls Virtual. On this show, we talk about different careers in the STEM fields, those fields being science, technology, engineering, and math. Today, we have Dr. Elizabeth Schlaudecker of the Division of Infectious Diseases in the Global Health Center at Cincinnati Children's Hospital. Liz, thank you for being here today.
I'm excited to be here and excited to talk with you all today.
Yeah, we're excited too. First off, what is the Division of Infectious Diseases and what is its purpose?
Yeah, so as you guys have probably heard lately, there are a lot of infectious diseases in the world, and particularly in children. I work at Cincinnati Children's, so I take care of kids who have infectious diseases. But kind of the cool thing about my job is that I get to see patients and take care of kids with infections, but I also get to do research and learn more about these infections in kids and how we can prevent them. So I do that within the Division of Infectious Diseases, and the Global Health Center is another part of Cincinnati Children's, and it's not just our division, but it's several different physicians and other providers around the hospital who do work in the global health setting. So it usually involves partnering with hospitals and communities around the world to provide better healthcare and research for those places as well.
Oh, wow. So Cincinnati Children's Hospital is globally impacting children. That's wonderful.
Exactly.
That's wonderful.
Yeah, and I think the cool thing about it, you know, our motto here at Cincinnati Children's, and kind of our priority is to help make children's lives better. And that is true, not just in Cincinnati and not just in Ohio, not just in our country, but around the world, you know, changing the outcomes for children and making infections better in my particular case. And infectious diseases, even though we have a lot of breakthroughs like antibiotics and vaccines, there's still a large problem around the world and continue to be. And that's probably fairly obvious to many of you right now with a new virus emerging, that despite all the progress we've made, you know, there's still new infections, new viruses, new bacteria that we have to contend with.
Okay. What is your role within the Division of Infectious Diseases?
Yeah, I'm one of the physicians or providers. So I provide medical care both in the hospital. So when if a child is admitted to the hospital and has pneumonia or some other infection that needs advice from a subspecialist in infectious diseases, which means I'm a pediatrician, but then I also did extra training in infectious diseases. So I can take care of kids, and I have general pediatric training, which I'm thankful for that I did my training here at Cincinnati Children's, but I also have training so that I can take care of kids with specific infections. So they will call us and ask us to come see the patient. And then we also have a clinic here. So we'll see patients after they're discharged from the hospital, or if a pediatrician has a question about an infection, they come see us in our clinic. So that's part of my job, and I am the clinical director for infectious diseases. So I sort of run that side of our division. However, I also spend over half my time doing research in infections in children, and that is, you know, a really exciting part of working at a place like Cincinnati Children's, because, you know, we're doing lots of really exciting research. Many of you know that the polio virus vaccine was invented at Cincinnati Children's, and everybody gets the polio vaccine now so that we don't see polio anymore. And the rotavirus vaccine was invented here more recently, and that prevents a gastrointestinal stomach virus, rotavirus, and you get that when you're a baby in a vaccine. And then we are, you know, working on new vaccines here for COVID and other things that will hopefully prevent infections. So the research here is everywhere from laboratory research. My office here within the Division of Infectious Diseases is adjacent to a long row of laboratories. that is within our division. And then we also have a research clinic right next to our offices where we see kids who are in research studies, where we're looking for answers to these questions. So everywhere from laboratory research where you're working on one particular small part of a virus to working with kids and their parents to do research. It's all part of what we do here in the division, which is very exciting. And the Global Health Center takes that even further to a global level and not just here in Cincinnati.
Oh, wow. Wow. There's a lot going on over there.
Very busy right now, very busy.
So is there a typical day at work for you?
Yeah, I mean, part of the fun part of my job is that every day is a little bit different. And that's part of what I like about it is I have a mix of those things every day. But I can tell you a little bit about my day yesterday, which is a fairly typical day. I was in the clinic, which is just across the concourse in the main hospital, and I saw patients in the morning. And part of what we're doing right now during the pandemic is we're seeing more kids via telehealth, which meant I had some kids who were coming in to see me in the clinic in person, and some kids who were calling in on a video screen like we're doing right now. Most of them were kids that I'd seen before, and we were just checking in about treatment. So we have a cool video screen where we were checking in and doing visits both in person and in the clinic. And I also have trainees with me who are learning to be infectious disease doctors. So we have teaching throughout the day where I'm sort of training the fellow how to be an infectious disease doctor. And then after that, I came back to my office and I had a conference call with the CDC, which is the Centers for Disease Control and Prevention. And we work closely with them. We did before the pandemic because we do lots of our research in looking at respiratory viruses in kids. And of course, during the pandemic, we've been talking to them even more frequently as we try to answer questions about COVID. So we were planning some of our research studies and making sure that everybody had the resources they needed. We were checking in on how the research was going. It's very cool when you are working with a large federal institution like the CDC. There are people from all over the country working with you. So we were working with pediatric hospitals all around the country and working together on our conference call. So we had that conference call for a bit, and then I was turning in a grant for a vaccine study. And for those of you who don't know what grants are, it's basically a proposal where you write out a plan for your research and you ask for some financial support to do the research. So it's part of what we do when we are starting a research project. We write a proposal, and then when we are finishing up the research project, we write a paper about what we found out so that we can pass it on to others and make sure the information is disseminated. So I do a lot of writing in my job, and I really like that, where I get to do scientific writing. And I've always liked reading and writing, so I appreciate that I get to put that in my job. And then at the end of the day, I had a meeting with one of my colleagues, and we again were planning, kind of checking in on some of our COVID-19 research and deciding our plan for today and checking in about that. And then I did a couple other things, working on making sure that I followed up with my patients from the morning. And the other cool thing about technology is now all of our charts and all of our medical records are able to be accessed by the parents at home too. So they can see the lab results and send me a message, and I can send them a message back, and they can send me pictures over the electronic medical records. So yeah, it was a busy day yesterday and a mix of research and seeing patients. And that's what I like a lot about my job, is getting to do those different things every day.
Yeah, there's a lot of variety, it sounds like, in what you're doing. It never gets boring, I'm sure.
Nope, it's very exciting for sure. Absolutely.
Yeah. So have you always been interested in STEM?
Yeah, that's a great question. So I would say yes, I've always been interested in STEM. I've always loved science, and I've always loved asking questions, but I've also always loved reading and writing and history. So I think I was a little worried when I was in training that if I become a doctor, if I go to medical school, I'm going to be kind of locked into, you know, only the sciences. And as I just mentioned, that has not been true. I really, I almost, I love the combination of things even more. Like I love math and I think it's so fascinating. And I think it's a really fun thing to figure out, but I'm glad that I don't just do math all day. Like it's good that I get to mix it into my work. So yeah, one of my favorite things when I was young, I've always loved animals and biology, and I like to be outside a lot, and I like to, you know, ask questions about what was going on. But I also liked how, you know, how the parts of things that we see outside and animals, I like how that kind of feeds into our history and our humanity and affects kind of who we are as people. So I didn't just limit it to the math and science side of things. And of course, that's true for all the STEM careers, really. I think I just didn't realize that when I was young. So yeah, I'm glad that I wasn't afraid of that, and I decided to keep pursuing it despite not being sure exactly what it would hold for me.
Great. Yeah. So in particular, what made you want to study infectious diseases?
Yeah, I do. I look back and try to remember exactly when I started being interested in infectious diseases, because when you think about it, infections, little viruses and bacteria are really kind of our smallest creatures, and they are they're sort of something that I've always been interested in. But I really think that the time that I became really interested was towards the end of high school into college, when I started thinking about how infections and infectious diseases had affected our world. So you probably have started learning about the 1918 flu pandemic. It hit in the middle of the World War I, when it was starting in the United States, and lots of young men were in barracks together. And so our first outbreaks were within these crowded conditions. And many of these diseases, you know, killed more people than the actual battles did. And the history of our Central American neighbors and South American neighbors, and how when Europeans came over, that they brought new diseases to these populations and kind of decimated some of these populations of the Incans and the Aztecs, and how that changed our history, and how these tiny little seemingly insignificant creatures can have such an impact if we don't learn about them and study them. And the interesting thing about the flu pandemic in 1918, we were just really starting to understand that viruses even existed. You know, we thought before then that diseases were caused by bad humors and miasma, and people who you know were in situations of poverty. We blamed them for getting diseases. And so I think part of what I found fascinating is that, you know, if we don't try to learn about them and we don't try to understand them, then they will always be one step ahead of us. You know, we have to understand them well to make sure we're protected from these diseases. And you know, they're constantly evolving and constantly changing, and I find that very interesting and fascinating. And the other great thing about them is we can treat most of them. That's the really cool thing. You know, it's a really great field to be in, because we do have antibiotics for most bacterial infections. We do have vaccines for a lot of the viruses. And COVID, I think everyone is very impressed and excited by how quickly the vaccine trials are starting. The technology is really amazing, that we have the ability to even sequence and figure out the virus. It was within a week of it being identified that we were able to actually exactly sequence the virus. And that is just spectacular. It helps us so much to get a good handle on the new diseases. So that's the part that I think is exciting. And I have always been interested in. I do think, we are humbled by the infectious diseases as well, though. They are constantly changing and new ones. And when we think we've got it under control, something like COVID-19 pops up. So it is, that's the part that makes it interesting, but it also is really rewarding because we get to treat kids and help them get better.
Great. So you've touched on this a little bit, but what kind of challenges do you face in your job?
I think research is extremely rewarding, but also extremely challenging sometimes. And as you can probably imagine, when you think that you have, so research is all about asking questions and finding answers to those questions. So part of the exciting part of it is figuring out those answers, but it doesn't always go as planned. And honestly, that is sometimes I can look at it on the bright side and think, oh, this is a fun little challenge. And other times it is a very challenging thing to happen. When I did my fellowship project, so when I was finished with my pediatrics training and I did a fellowship in infectious diseases, I studied and did my research in Honduras, which was near and dear to my heart. The University of Cincinnati had long had a partnership with that community, and I had been traveling there for many years. So they had sort of asked me to help them answer some questions about respiratory viruses. So I worked in partnership with the Honduran doctors and spent some time there studying respiratory viruses in kids. But right when I went there to start my research, their government had a coup, which was, obviously not part of my plan. And they had a shutdown of their country, and things changed a lot down there. And so there was a big delay on the research because the place that reviews the research and makes sure that it's safe for their country was closed for a while. And so I had a big delay, and then I ended up getting started. It was just about 6 months late. And then we had to figure out how to get the samples back to the United States. And there was only one place in the country at that time that made dry ice. And so we had to track down and in fact, these things are kind of fun and adventurous, solving these problems and figuring out how to be flexible and roll with it. But, in the middle of the night when you're trying to figure out how you're going to get into this facility and ask them for dry ice, it is, I was definitely worried because like I've worked so hard to get all these samples, and I will be very sad if we can't safely keep them frozen and bring them back. So, learning to be flexible, and I always feel like travel in general is an exercise in being flexible and relaxed, and research is kind of that way too. You will talk to some of the most famous and successful researchers. In fact, our own team that developed the rotavirus vaccine here, they tell a great story about the failures that occurred before they got to the final product. And learning to not give up and not feel frustrated when you don't get a grant or an experiment doesn't work or you don't get the results that you expected is sometimes hard. But learning to keep going and not giving up, I think, is an important lesson. And the same thing is true in the hospital setting. You sometimes you think you've made the right diagnosis and picked the right treatment, and it's not working exactly as you want it to. But, for the sake of all people involved and the patient, not giving up and keep looking for answers and keep trying and not getting discouraged is really important. So yeah, that's probably the biggest challenge. And I think I've grown up and changed and learned a lot over the years, but I continue to learn a lot as each day goes by.
Great. And some good advice in there of, don't be fearful of trying or failure. That's good advice for anyone at any age.
Absolutely.
Yeah. So you are studying COVID-19. What are you studying in particular?
Yeah, so I mentioned earlier that my main research interest has always been respiratory viruses, influenza in particular, and actually, particularly how your immune system responds to influenza and influenza vaccine. So, my colleague, Dr. Mary Stott, and I are part of a large study that started in the last couple of years where we were actually trying to figure out, what is that first exposure to influenza and how does it affect your lifetime response to that virus? And that is also something that translates to other respiratory viruses. So this study was already in place with many participants already enrolled and investigating that. So when we were first made aware and first aware that COVID-19 was starting to circulate, we were able to add that on to the research and start getting weekly tests for COVID-19 via nasal swab as well. And it was actually a great system because they were already getting those nasal swabs at home and sending them to us for flu virus and other respiratory viruses. And so we were able to start checking them for COVID-19. And the great part about that is that we can kind of see if it's an asymptomatic infection. We'll find it even if they're unaware that they have symptoms. And so the big thing that we study is, first of all, the epidemiology and, how it's spreading within households, who's getting it. And then also looking at your immune response to the infection. You've probably heard a lot in the news, we're really trying to figure out that antibody response to COVID-19. Are people having antibody responses even if they have an asymptomatic infection? And is that going to be enough to protect people from future infections? Is that going to be a similar response that we get from the vaccine? So that's something that we're actively looking at and studying right now, trying to get answers about that. And it's challenging because as physicians, we dislike knowing so little about a virus. It's a hard spot to be in, to feel like each new finding that you have introduces another handful of questions. We find out, okay, you get an antibody in this situation, but is that antibody response going to last? And for those of you who don't talk about antibodies a lot, it's basically your body's immune response that protects you from future infection, usually. So when we are making vaccines, we're usually trying to give your body something that makes them think they're getting an infection. So it might be like a little tiny piece of a virus, or it might be something that looks like a virus but isn't actually the virus. And when your body gets that vaccine, it makes its own antibody response plus maybe other different immune cells. So if you ever get the real infection, you have this army ready to come and fight off the infection for you. So it's a pretty cool concept, but we know with things like colds, when you get rhinovirus, which is a common cold virus, we know that you actually don't get protected from future cold viruses. You just keep on getting, you're maybe protected for a little while, but then unfortunately, colds are, repetitive viruses. You keep getting them. And so we're trying to figure out a way with coronavirus not to let that happen, how to get a lasting immune response. So we first kind of have to figure out how you respond to the infection at all. How do you even, respond to that? And that hopefully will give us the ability to compare that to vaccine responses as well. So there's a lot of exciting things going, not just for me, but within our division, looking at new COVID vaccines. That's been in the news also, and looking at different ways that we are hopefully becoming immune to this virus. But it is definitely a very busy time and very hard to, it's very hard to watch this happen to our country. We've always worried about a new virus circulating around the world, and so when it happens, we're always very disappointed and frustrated, of course, that it's happening. So yeah, I've been dealing with a lot of frustration, like this isn't supposed to be happening. I wish it wasn't happening for sure, but we're doing our best to learn more and fight the good fight against it.
Right. And I know things are almost changing on a daily basis of understanding the virus. Is there anything you can tell us you've learned from it?
Yeah, I think the good news, and a lot of people have probably heard this by now, but being a pediatric infectious disease doctor, we've actually been very fortunate that it does not seem to affect kids as severely as other respiratory viruses. So the flu virus particularly affects young infants and children quite significantly. Same with respiratory syncytial virus, which is the virus that causes bronchiolitis, which is a lung infection that we mostly see in kids under 12 months of age. So when this was starting, we suspected that it would probably be like other respiratory viruses and be really hard on kids. And so that's been the really good news, is that, it continues to demonstrate very low rates of hospitalization and very low rates of complications in kids. So we're working with our adult colleagues to try to, support them and understand the virus more. But we're thankful that, that the kids seem to be tolerating the virus well. And we don't really know why, which is interesting. We're trying to figure that out. There's some hypotheses, but we're not for sure why kids don't get it as often. But it's very good news that they seem to be staying safe.
That is great news. Yeah. My last question, Liz, is what advice would you give to young women and girls who are interested in STEM and are interested in having a career in a STEM field?
Absolutely. I think my best advice is to keep asking questions and not give up on being curious, and starting basically that sense of discovery at a young age. And I think sometimes, when you're in the thick of studies and you sometimes, have some letdowns or things don't go exactly as planned, it's easy to forget about the reason that you love what you're studying, and just to find the questions in everyday life. If there's something that interests you, if astronomy is interesting to you, learn more about that and read more about and ask questions about astronomy. If animals interest you, read about those, learn more about those. If viruses and bacteria interest you, there are great books out there for young people about different infections. Especially right now, I know there are more out there in the middle of the pandemic. So I think just keeping that sense of curiosity, you're already a scientist, and you're already on the path to a life of discovery, and I encourage you to keep it up.
Wonderful. Well, thank you for joining us today, and thank you all for joining us today too. A big thank you to Dr. Elizabeth Schlaudecker of the Division of Infectious Diseases at the Global Health Center at Cincinnati Children's. Liz, thank you.
Thank you so much for having me.
Have a great day, everyone.